Today's focus is on the structure of the NCLEX-RN, specifically the next-generation NCLEX format, which is a critical first step to passing. The exam uses computer adaptive testing, or CAT, which means the difficulty of each question you see is determined by your answer to the previous one. If you answer correctly, the computer serves you a slightly harder question. If you answer incorrectly, you'll receive a slightly easier one. The exam's goal is to determine with 95% statistical certainty if your ability is above or below the passing standard. This is a common point of anxiety. The exam can end any time between 85 and 150 questions. A major exam trap is panicking when the test shuts off at 85. Many candidates mistakenly believe they failed because it ended so quickly. In reality, shutting off at the minimum number of questions is a strong indicator that you have clearly demonstrated your competency and passed. The computer has made its decision. Conversely, don't lose confidence if your exam continues past 85 questions. It simply means the algorithm needs more data to make a confident decision. You have up to 5 hours to complete the exam, which includes all breaks, so time management is a factor. But the adaptive format means most won't run out of time. The Next Generation NCLEX, or NGN, was introduced to better measure a candidate's clinical judgment. This is the absolute core of the modern exam. The content is still organized under the familiar framework of client needs categories. This includes safe and effective care environment, which covers management of care and safety and infection control. Then there's health promotion and maintenance, psychosocial integrity, and the largest category, physiological integrity. These are not just content areas to memorize. They are interwoven with integrated processes like the nursing process, caring, communication, and teaching and learning. The biggest change with the NGN is the introduction of new question formats designed to simulate real-world nursing scenarios. You will encounter unfolding case studies, which present a client's evolving situation through a series of 6 questions. These questions require you to recognize cues, analyze them, generate hypotheses, and determine appropriate actions. For example, a case study might present a patient's electronic health record with a chart, nurse's notes, and lab results, and then ask you to identify which findings are most significant or what action the nurse should take first. This is a direct test of clinical judgment. Importantly, NGN uses a new scoring model for many questions, offering partial credit. You no longer need to get everything perfect to earn points, which better reflects the complexities of nursing practice. Other new item types include matrix questions, where you evaluate multiple options against multiple criteria, and trend questions that require you to analyze data over time. A common trap is becoming intimidated by these new formats. At their core, they still rely on foundational nursing knowledge. The exam isn't trying to trick you with the format, but rather to see how you apply your knowledge in a realistic context. A helpful way to remember the focus of the new exam is to think that NGN wants you to use your CJ on the job. CJ stands for clinical judgment, and it's your co-pilot journeying through the NCLEX. This simple phrase reminds you that every question, especially the new NGN formats, is designed to answer one fundamental question: can this candidate make safe and effective clinical judgments? So, when you study, don't just memorize facts. Constantly ask yourself the why behind nursing interventions and priorities. The exam is less about what you know and more about how you think with the knowledge you have. Understanding this structure, from the adaptive testing model to the clinical judgment focus of the NGN items, removes the element of surprise and allows you to build a study plan that targets the skills the NCLEX is actually measuring.